Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Catherine Magnuson, and I'll be your host. For today's webinar, we're going to be hearing we're going to be talking about administrative burdens in the time of COVID-19. And I'm really delighted to introduce our presenters, Pam and Don Moynihan. They are the authors of the book, Administrative Burden, Policymaking by Other Means, and they are both long-time IRP affiliates and are faculty at the McCourt School of Public Policy at Georgetown University. I want to thank them very much for taking time to be with us today. I also want to thank the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any views or opinions expressed in today's webinar aren't necessarily those of ASPE or any other agency of the federal government or the Institute for Research on Poverty. I think we all know that there's a lot of online meeting platforms like the one that we're on today are seeing very heavy use right now, and we have a lot of people joining us today, which is really exciting. We're going to do everything we can to keep things up and running as best as we can. But if you're having trouble, we have set up an alternate Zoom meeting room that you can join or call in to get audio. You have all that information about the Zoom access is in the technical notes box at the bottom of your screen. We will also have a recording available on the IRP website and via email later this week. And if you stick around to the end of today, we'll have a copy of the slides available for download during the question and answer portion. We have about an hour today, and in just a moment, I'm going to turn it over to Pam and Don. Their presentation should run about 40 to 45 minutes, and we're going to save the last 15 minutes for your questions. You can type those questions into the Q&A box, which you'll also see at the bottom of your screen, and you can start populating those questions, writing in those questions at any time during their talk. You don't need to wait until the end. I know we're all joining from various places around the country and under different circumstances. So we're glad that you can be with us today, and we're particularly grateful that Pam and Don are here with us. So I'll turn it over to you two now. Go ahead, Don and Pam.
Thank you. This is Don.
And this is Pam.
So we are delighted to be back in Wisconsin, even if it's only digitally and over this webinar. Welcome to everyone for joining us. So as Catherine mentioned, what we're going to talk about today is a summary of our book, Administrative Burden, Policymaking by Other Means, as well as a reflection on what these administrative burdens mean now in the time of a pandemic. And we're going to start by talking about the first page of the book and the first example from the book, which is the story of a family in another time of crisis immediately after 9/11. The picture you see is of Merle and Robert Mayo and their son Corbin. And the story we start telling in the book is about after September 11th. Amidst unimaginable grief, victims' families found themselves awash in paperwork applying to everything from workers' compensation to private charitable support and life insurance. Merle Mayo lost her husband in the World Trade Center. In the days following his death, she spent countless hours finding out what financial resources she was eligible for, filling out forms, pulling together documentation, and dealing with officials who offered varying levels of help and sympathy. Everything was scattered all over the place, she said. And then I thought about all of the things I had to do and all the laundry that was overflowing from the hamper, and I felt so overwhelmed that I broke down so badly. I couldn't even catch my breath. I sat down on the floor just like, I have to do this. I have to cry now. And I did. Yet Mayo remembered one application process as being refreshingly simple, Social Security. She just had to make a phone call and fill out a simple form online, or if it was more convenient, she could have gotten help from one of thousands of Social Security field offices spread throughout the country. The first Social Security checks to victims' families were mailed out on October 3rd, 2001, less than a month after the attack of September 11th. This is a simple example of how we want government to work. A public agency offered helping hand at a moment when help was desperately needed, All too often, our experience with government is the opposite, characterized by confusion, delay, and frustration. And so the seminar is about these administrative burdens, their political and organizational origins, how they affect citizens, and how governments can minimize them. I'll talk for the first half of the seminar about these issues, basically discussing some definitional characteristics of administrative burdens, and then Pam will talk in the second half more about the applications in the time of the coronavirus. So a second example that brings us up to the present date, this is a posting from a friend of ours who shared the experience of her niece, who was a waitress in Arizona, had been laid off and was trying to get public health insurance and food stamps, and simply found the experience to be the opposite of Merrill's Mayo. She felt that government was not helping her, and in fact, it seemed to be making it deliberately more difficult for her to get access to benefits. And unfortunately, that has been the experience for lots and lots of people in the last couple of months as they've struggled with things like unemployment insurance at a time of fairly significant financial need. So our talk today is going to try to cover three big topics. What are these administrative burdens we talk about? Why do they matter? And if you believe that they're important, how can we actually reduce them? And so we use this term administrative burdens. My background is I have a PhD in public administration. Pam is a sociologist who studies public policy. We also draw on research from political science and from economics, and across a range of scholarly disciplines, and also across a range of different policy areas, we kept finding people talking about frictions or red tape or barriers that people encountered when they dealt with the state. And we didn't see a unifying, overarching language to make sense of those experiences, and so that's what we set out to build. This common language and a conceptual frame that helps us to make sense of the experiences people have when they interact with the government, whether it's trying to vote or enroll in Social Security or get access to unemployment insurance. One pretty big caveat we want to lay out is whether burdens are always uniformly bad. And our answer to this is no. There are going to be times when the state has legitimate purpose in imposing costs upon citizens and individuals. And our focus on burdens here is really on the cost that individuals and not companies or private organizations face. So there are times when those burdens are justified. There are also going to be times when the costs are greater than the benefits. And there are going to be instances when the benefits seem to be perhaps not existing at all, but costs are dramatically high for individuals. The book is mostly about those latter two examples, when the costs are too high relative to any potential benefits or the benefits don't really exist. So what are administrative burdens? We find it intuitive to break it down into three basic categories. The first category is learning costs, the second is compliance costs, the third is psychological costs. And by learning costs, we mean engaging in search processes that pull together information about public services you might be eligible for, what you might have to do to get access to that services, what forms you might have to fill out, do you have to go to a physical office, do you have to pull together documentation. We're not born with that knowledge. It takes a certain amount of effort on our part to pull that information together. And so, for example, something even like the Earned Income Tax Credit, which is one of our largest welfare programs, about half of the people who are eligible for that program couldn't describe for you what the EITC actually means. They don't know that they're eligible for it. So even very well-known programs, people don't intuitively know what they mean and whether they're eligible for them. These learning costs become higher at a time when there's a lot of policy change and when there are a lot of new programs, and that's exactly what we're seeing now, given the congressional and state-level responses to COVID-19. The second type of cost is compliance costs, and this falls into the category of what we might more traditionally think of as red tape, but dealing with administrative rules and requirements, providing documentation, filling out forms, dealing with discretionary demands placed upon you by a bureaucrat, if you have to travel somewhere, if you have to hire a lawyer to help you. These are all compliance costs. And these can vary quite a bit. Sometimes they can be relatively trivial, with the example of Social Security we gave earlier, and sometimes they can be fairly significant. And so again, sticking with the example of the Earned Income Tax Credit, we have third-party actors like tax preparers who can help to reduce the compliance costs of claiming the EITC, but they charge quite a bit for the individuals who take up that service. So something like 5% of the cost of the EITC ends up going directly to these tax preparation agencies. And the final cost is a sort of larger bucket that we're labeling as psychological costs. And this can come from the stigma of participating in a program that is viewed negatively by the public. It can arise from a loss of autonomy that we experience when we interact with public actors, when we are subjects and they have power over us. It can be related to the sort of stress or frustration that comes from dealing with processes that are difficult to negotiate, or a sense that you will be unable to actually get the benefit that you need, as signified by the text examples I gave earlier from the waitress who lost her job. So psychological costs is a broad bucket, but it really covers the idea that these are not just these transactional costs that individuals encounter. It also has an effect on the person, and that effect can be enough to sometimes discourage people from seeking out benefits when they feel so frustrated that they're willing to give up. So I'm going to transition now into talking about why burdens matter. And the first of those reasons is that we argue about in the book is that burdens have a big effect. They are consequential. And so this is the point where I'm going to hand over to Pam to take over at this point.
So burdens are consequential. Importantly, one of the things that they do, or the key problem with them, is that they really undermine key policy goals. If the goal of pandemic relief was to ensure that we softened the economic and health consequences of a pandemic, one of the things that we have come to realize over the last few months is arguably we have not effectively achieved that goal. I think arguably you can make the case that the issue has been not so much the amount of relief that has been offered, but the degree to which that relief has not actually reached the people it's supposed to reach. So a key point basically about what's going on with the coronavirus stimulus is the fact that they chose to deliver relief through an existing set of social welfare programs that have a high levels of burden in them. So I'm going to first talk about unemployment insurance, actually. Unemployment insurance varies at the state level. Each state has a specific set of rules and criteria about how you qualify. It's sort of partially federally funded, but states have quite a bit of control over who gets onto the program and what they need to do to stay on the program as well. And even in the best of times, take-up for unemployment insurance, that is the fraction of people who are eligible who actually participate, is somewhere around 3/4 of the population of those eligible. And one of the things that happened with the pandemic relief bill when they decided to distribute aid effectively through unemployment insurance was that these systems almost immediately became completely overwhelmed. So Florida has received a ton of attention, and so this is just one case, but even as of mid-May, Florida had actually only processed 1/3 of the benefit applications that they'd received for unemployment. And in large part, this reflected about maybe 7 or 8 years of changes to Florida's unemployment insurance system where they were trying to control costs, and the mechanism by which they tried to control costs was to effectively increase administrative burdens in the program. They make it harder to apply, they made it harder to continue to stay on the program, to do the kinds of documentation you needed to do to stay on the program. And so that system kind of clashed with the surge in people seeking unemployment when people needed to access that during the pandemic. The second part of the reason why unemployment insurance became problematic is not just that the existing system had a lot of burdens built into it, really across most states. The second issue actually was that the federal government didn't just sort of try to distribute aid through the existing system. They wanted to add a whole new class of beneficiaries to the program. These were basically gig workers. And that additional program would require new administration. It would require the ability to process different kinds of documentation than they would typically process for unemployment insurance. And so most states actually didn't start even delivering that aid until into May. Many states have not delivered very much of that aid, the sort of new pandemic program for people who were gig workers. So effectively, they tried to funnel a lot of money through a program that was already administratively complicated and then added additional administrative layers, all of which impeded the ability of states to effectively distribute these dollars. Interestingly enough, the second part of the relief that was intended to protect people, particularly to protect people who might lose jobs, were these small business loans. It was actually called the Paycheck Protection Program. And the idea was that we would distribute loans to small businesses. They would be told that those loans would be forgivable if they maintained a large fraction of their existing workforce rather than laying them off. But the reality of how they administered that program made the experience of small business owners analogous to the experiences of unemployed people trying to navigate the unemployment insurance system. They needed to go to banks to try to help them process the loans. The regulations, both for the banks and for the small business owners trying to navigate this, were incredibly confusing and unclear. Web system, as they were trying to apply online, web systems were crashing. And ultimately what happened is that, especially through the first round of relief, banks, because they were unclear about how to document eligibility and those sorts of things, ended up largely just servicing small businesses that they already worked with. And these tended to be the larger of the small businesses. So yet again, just like unemployed workers, small businesses were kind of met with these huge administrative barriers when they were trying to seek relief and trying to keep people on the payroll. And it's not just these sort of new programs. We know that existing social welfare programs, both Medicaid and SNAP, the Supplemental Nutrition Assistance Program, already are starting to face significantly increased demand on them. So for example, with Medicaid, the current estimates are that 27 million people will lose their health insurance. So people are going to be looking pretty quickly here to start accessing and applying to Medicaid. But there are a host of administrative barriers in the Medicaid program, some of which appear to be worsening over time, over at least the last 6 years. So to just give you a flavor of what's going on in the program, the picture on your screen is a six-year-old Abel Sewell. He lives in Chattanooga, Tennessee. He's a leukemia survivor, and he effectively needed blood tests monthly to make sure that he was still in remission. TennCare, the Medicaid program there, had covered those tests until October. Then his coverage basically vanished. And suddenly they were facing about $900 in medical bills that they couldn't afford to pay. What happened effectively is that Tennessee mails out its Medicaid renewal forms. Some of these forms are up to 47 pages long. If they didn't get a response, or if it was late or incomplete, you just simply lost coverage. So for the last couple of years, nearly 220,000 children in Tennessee lost coverage in this period of basically when they were supposed to be re-upping their eligibility. Keeping in mind, right, like mailed out forms, you're looking at populations who move a lot, for example. And this is not just Tennessee, Missouri. There's examples of this from Missouri and a few other states. And so effectively, right, if you're relying on mailing complex forms to people, some are going to get lost, some aren't going to be opened, some will be incomplete, and some will be late, and those will be riddled, and some just may have errors. And that leads to these sort of denials of access to health insurance. The Supplemental Nutrition Assistance Program is another example where we see a certain level of burden. Effectively, somewhere around 80 to 85% of those eligible for the program do participate, but we've seen a lot of variation over time in that participation rate in the SNAP program, a lot of which, not all, but a lot of which has been a function of how burdensome it is to apply and how burdensome it is to stay on the program. And again, over the past few years, there has been an uptick in proposed rule changes to the program that effectively would make it harder for people to apply and harder for people to stay on the program. Key among these is a proposed rule change which would make automatic eligibility, which a lot of people benefit from in food stamps based on their eligibility for other programs, no longer quite as easy or no longer the option that it currently is for states. So that a huge additional barrier, basically, putting people in a position where they need to fill out relatively complicated forms, document assets, and those sorts of kinds of compliance costs we know would reduce take-up of the program. And so there's been a push to include those sorts of additional requirements in the SNAP program. So as we see a surge in applications, currently about 17 states have posted data, and we're seeing about a 14% increase in SNAP participation so far. This is between February and April. This could become a larger issue over time if some of these rule changes go into place in the SNAP program. SNAP is also a place, though, where it's interesting in terms of pandemic relief. So one of the things that they did was, rather than just increase SNAP benefits, so one option would have been what they did during the Great Recession was just say automatically increase benefits for all SNAP participants by 10%. It requires nothing of a participant, right? You just get the benefit relief. Instead, what they decided to do was to give the special pandemic relief for kids who receive free and reduced school lunches. So they added effectively a new program, and those kids would receive additional SNAP dollars. That program was passed in mid-March. Currently, only 15% of those eligible are receiving those benefits. And effectively what it boiled down to is the administrative complexity of trying to start a new program in the middle of a pandemic. So this really reduced the capacity of states to actually deliver that aid quickly and effectively. And we see the consequences of that. So while it is the case that most kids on free and reduced lunch are already, for example, receiving SNAP, you just added this whole additional layer of like learning and compliance costs that reduce people's access to that program. A second reason why, though, broadly speaking, administrative burdens are really important are their distributive implications. Most social welfare policies that we have, right, their goal is to reduce poverty and to reduce inequality. Administrative burdens effectively really undermine that goal of, or can really undermine that goal of reducing poverty and inequality. So the first issue is that most poor people receive targeted social welfare benefits, and these include SNAP, Medicaid, the Earned Income Tax Credit. And while these are enormously valuable programs, and they have produced enormously beneficial outcomes in reducing economic security among the population, they are also tend to be laden with burdens. So poor people in general are far more subject to means testing that tends to lead to these kinds of burdens and programs. So that's sort of one way that we see that play out. The second way that this plays out is that because administrative burdens can be difficult to navigate, sort of arguably human capital, the skills that people have on hand influences their ability to kind of navigate these kinds of burdens. Your level of education, your level of economic resources actually, your health, your language skills, the amount of time you have to actually devote to processing these kinds of burdens to get at benefits that you need. All of these things inhibit people's ability to actually do this. So in general, there is certainly some evidence that people with more limited resources, especially people with, for example, low levels of literacy skills, are less likely to participate in programs for which they're eligible. The other part here that's sort of interesting is the role that third parties play in terms of helping people navigate burdens. So, for example, the Earned Income Tax Credit, which of course will be another policy that will become increasingly important over the next year as people face lost wages and even lost income. Part of the way that people can navigate these burdens is through these third parties. So the Earned Income Tax Credit, a lot of people receive help to try to access that benefit via tax preparers. And the challenge is that tax preparers have been enormously valuable in terms of getting people access to something like the Earned Income Tax Credit, actually. They've filled a real hole in terms of educating people and reducing learning costs so that people realize that they're eligible for the benefit, in terms of reducing the compliance costs, so helping people actually apply for it. But then we also know, as Don mentioned earlier, arguably about 5% of spending on EITC goes to those tax preparers. And so it reduces the amount of resources we have to spend on the people that we want to spend those resources on. It also raised some concerns that tax preparers, for example, have an incentive to keep a more complicated tax system in place, right? They benefit from the burdens in the system, and so this is another way in which third-party actors can play a somewhat complicated role in these relationships. Another example of this, especially in the context of the
sorry, Dave, can you advance the next slide, or Dawn? Thank you.
One back.
Hang on. I got it. Sorry.
There we go. Sorry about that. One particular example of the third party in the context of pandemic relief was exactly these banks in terms of the small business loan programs. And in the end, the way that played out is that banks did end up going and largely focusing on existing customers who did tend to be their sort of more well-off small business owners, larger among small business owners. And they provided enormous amount of resources in terms of helping those folks navigate the system, but a lot of other people were effectively left out. There are some interesting examples, actually, of this in the context of unemployment insurance. Universal Studios obviously laid off a lot of workers in Florida in terms of their theme parks, and they actually figured out a way to assist their employees in terms of navigating Florida's unemployment system by effectively enrolling in doing the work for their employees. So these third-party actors in some ways are helping, but in other ways maybe reinforcing or undermining certain programmatic goals. One thing that's important to keep in mind in terms of thinking about going forward and kind of what can we do with this, including I'm going to talk a little bit about what might we have done differently with pandemic relief, is recognizing that these burdens are constructed. These are not set in stone. And going back to our case of Florida, again, a lot of the problems in Florida's system were in fact by design. This is an aide to the current governor who talked about the fact that he described it as a profanity, you can all read, sandwich, and it was designed that way by former Governor Scott. It wasn't about saving money. It was about making it harder for people to get benefits or keep benefits so that the unemployment numbers were low to give this governor something to brag about. Everyone we talked to in that office, when we asked them what happened, tells us the system was designed to fail. That's not a problem when unemployment is 2.8%, but it's definitely a problem now. And we do see evidence of this in pandemic relief. There's a mixture of just being administratively overwhelmed, but there's also, particularly on unemployment insurance, a reflection of ways in which those systems were designed to make it difficult for people to both access those benefits and stay on them. So how can we actually reduce programs? One key big picture way that we can do this is get public officials to think differently about how they evaluate burdens, to think about this in terms of benefits and costs, to think about the distributional aspects. So writ large, what I mean by this is that we pay a ton of attention, and in fact, states are really required to pay a lot of attention to how much quote-unquote fraud and abuses there are in these programs. What people are getting these benefits who are not supposed to be getting these benefits because they're not eligible for them. We focus a ton of attention on that, and states are required to report on that. What states are not required to do, and what most federal programs are not required to do in a systematic way, is report on the fraction of people who are not receiving benefits for which they are entitled. So most programs have fraud and abuse rates, and keep in mind, fraud and abuse typically can also include things like people just making mistakes on forms and getting benefits they shouldn't as a result of that, or benefits that are slightly too large. Those tend to be anywhere from, say, 2 to 4%. Whereas even in our best run targeted programs, like SNAP, like the Earned Income Tax Credit, somewhere around 20% of people who should be receiving those benefits aren't. And it's substantially higher now in the unemployment insurance system. So we need public officials to take that seriously. We need public officials to take that seriously when they're evaluating the design in terms of how these programs are actually implemented, that we don't just focus on who shouldn't be getting benefits, but be focused on ensuring those who are eligible for them and who should be receiving them are. There are ways to think about deconstructing burdens. Technology is a key tool that we often think about in terms of reducing burdens. But one thing, so for example, right, internet access. Most of us sort of feel like it's a lot easier to fill out a form online than to fill out a mail form and mail it back in. But it's important to keep in mind that these technologies can vary in their impact. So sometimes it is true that online forms are great. In other instances, though, these sorts of things have been explicitly used as burdens. To go back to Florida, they actually, for a period, would only allow people to apply online. And this actually reduced people's access to the program because a lot of people, particularly people in rural areas and some low-income populations and older adults, actually just don't have access to the internet to do this. So what you want to think more broadly about when we talk about technology are effectively a range of technologies, a range of different ways that we can help people access to enroll in programs and to do the kinds of things that they need to do to stay on them. Automation is probably the most important way in which we can reduce burdens. So in its most classical form, people talk about this as sort of changing the default. So when you're for savings for retirement, your employer, if your employer just automatically enrolls you as opposed to requiring you to enroll, we see dramatically higher participation rates. And this holds for public programs too. The degree to which effectively we can automatically enroll people in programs, the degree to which we can, instead of require people to provide documentation, we can look to existing administrative systems, whether it be the IRS or some other state agency that has information on people to just sort of automatically reduce those sorts of compliance requirements. And most states actually do have the capacity, they have the information to dramatically reduce these kinds of documentation requirements to get people enrolled. But states do need to be capable, they do need to have the administrative capacity to do that, and they also need to be willing to do it as well. And it's really important to understand as well that in terms of deconstructing burdens, when help is actually required. So there are ways in which we can look to simplify forms or do better outreach or so on and so forth. But we have a lot of examples actually that sometimes we just need to fill those forms out for people. For example, sometimes we need to sit down with people and walk them through the process and educate them and do those sorts of things for them, as opposed to just providing advice or more simplified kinds of help. Sometimes people really need intensive help. More broadly, I think the point here is when nudges are not enough, right? When it's not enough to do simple changes to forms or reminders or sorts of simple processes to do things like reduce learning and compliance costs. The big picture is that you want to do the best you can to shift the burden to the state. Shift the burden to the state to ensure that people are eligible rather than putting that burden on individuals. So for example, Social Security, which we started with, the Social Security Retirement Program, is one of the best examples of this. Social Security is actually just as complicated as a program like the Supplemental Nutrition Assistance Program or even Medicaid in terms of the kinds of documentation, in terms of the things that the state needs to know about you to ensure that you're both eligible and also to ensure that you're getting the correct amount of benefits. It's just as complicated for Social Security, actually. It's just that we put all of that complexity to the state. The state's responsible for it. So the federal government collects your earnings data over the course of your lifetime, right? They document that for you. So that all you need to do when you want to apply for retirement or in the case where you have, say, a spouse pass away, all you need to do is go online, go to one of 1,600 or 1,700 Social Security offices around the country, fill out a very simple form, and you have your benefits. So that model of administration is kind of the gold standard in terms of thinking about how we can design programs in ways that are far more effective and far less burdensome. And so if we go back and think about the kinds of ways that we tried to deliver pandemic relief, we can really see if policymakers had thought seriously about the implementation and about the processes by which these relief efforts would actually be delivered, you might arguably have taken a very different route to how you delivered aid. We're in a place now where a lot of people, large fractions of those eligible, have not received their unemployment insurance. As I mentioned earlier, additional SNAP relief that would come from the special EBT program for kids receiving free and reduced lunch. Again, only 15% of kids are receiving that. We have not distributed the aid that people need, and there's some significant consequences coming forward in terms of anecdotal reports, for example, around concerns about evictions coming up. So what could we have done differently? The most simple thing was, frankly, what a bunch of European countries decided to do, and which a couple of representatives, actually both a Republican and a Democrat, proposed in the U.S., which is another form of the Paycheck Protection Program. What instead we could have done was effectively just guarantee small businesses and businesses generally, they could have guaranteed payroll of the federal government. We had a different level of administrative capacity to do that. It would require nothing on the part of individuals in terms of, quote unquote, accessing that benefit because they would have been less likely to lose their jobs. Additional things, as I already mentioned, around SNAP would have been, instead of creating a brand new program for kids in the free and reduced lunch program, you just could have increased SNAP benefits. There's a range of different ways if administrative burdens were a principle in terms of how we thought about delivering relief that we might have done differently, and we might have had a much faster and more equitable distribution of aid during the pandemic. So we'll stop there, and I'm happy to take questions.
Thank you, Pamela. So we have some questions that came in while you were talking. I have my own questions that I may not be able to keep out of the mix. But also people are welcome to keep typing in questions for the next few minutes. So I want to start with one question that came in. What in this current time, what would you suggest as 1, 2, 3 concrete things that states might be able to do, or localities, to reduce administrative burden, now?
One thing around unemployment insurance, and what's a little bit tricky, is the federal government would have to be involved here in terms of relaxing some rules. But a key thing that you can think about broadly about reducing burden in programs with eligibility requirements is sort of back-end verification. So the idea is you enroll people as long as they produce sufficient enough evidence, basically. Not as much as you want to ensure that they're eligible, but maybe just enough. You just enroll them quickly. And then you go back and you clean up after the fact to fix if people are enrolled who shouldn't be enrolled or if their benefits are too large. But that is one thing right off the bat that could really, I think, reduce the kinds of overload a lot of unemployment insurance programs are seeing. And it's actually analogous to things we do in other programs. We actually do this in Medicaid. There's a provision in Medicaid that effectively allows certain entities to just enroll people in Medicaid right away as long as they look close enough to eligible, basically. And then there's a formal verification process that goes on after the fact. So we have mechanisms to do this already in existing programs. Those could be applied to a program, for example, like unemployment insurance. That would be one thing I would point to.
I wanted to circle back and ask you what you thought the complexity of having a federal and state and local delivery system, how does that add to or take away from some of the administrative burdens?
So I think this is a time when we were seeing pretty clearly the cost of the federalist system. In times of any sort of crisis, the thing that's most important is speed of response. And with a federalist system, you have multiple veto players who can layer on more burdens, who might have varying administrative capacity, who might disagree with the fundamental goals of the program and end up watering down the effectiveness of the program that you're trying to implement. And so on the one hand, we celebrate the federalist system for allowing these laboratories of democracy where different states can experiment to different degrees. But one of the costs of the federalist system is that, as has been revealed by the pandemic EBT to support kids who no longer have access to free or reduced school lunch, it's very hard to quickly wheel up that federalist machinery to deliver a new program. So in one, again, maybe this reflects perhaps your previous question, if we could have persuaded Congress to do some different things, one approach would have been essentially to rely more on the federalist programs that are already in place and work reasonably well, like SNAP, and simply expand those programs. So don't ask people to fill out new forms, don't ask state officials to go to their local schools to pull together new administrative data in the midst of a pandemic, but simply just invest more in the systems that you already have. But I do think we are seeing the magnified effects of this federalist system that reflects an underlying tension of the system, because as we document in our book, there's already lots and lots of variation across states when it comes to take up for these sorts of programs, and much of it has to do with the fact that some states are not terribly interested in making programs successful, and so they will deliberately impose burdens into the process. At the moment, we're just seeing more delay because states are overwhelmed, but that's a cost of federalism, that sort of variation we see from Texas to Minnesota, from Washington to Maine.
The federalism also just really increases just basic learning costs too, right? Because if you live in, like, say I lived in Connecticut for 5 years and I had a vague awareness of how unemployment insurance worked in Connecticut, and then I moved to Texas, well, it's going to work completely differently. And it just introduces enormous amounts of confusion given how dramatically the rules can differ across states in terms of just even basic eligibility and how you document it and how you apply, can even vary within states. So for the Medicaid program, it can vary at the county level in terms of what kind of administrative procedures are required. And there are examples, recent cases in Minnesota of people moving to a different county, people with kids with significant disabilities moving between counties in Minnesota because some counties were just notorious for making it impossible to get on Medicaid. California has the same issue with SNAP. Their SNAP enrollment is done at the county level, and there's actually quite a bit of variation across counties in terms of enrollment in SNAP. So yeah, it introduces an enormous amount of complexity. And just to point out quick, a kind of interesting historical irony, I guess, Social Security and unemployment insurance were both a part of the same New Deal program. And there was a lot of debate about both those programs, about how they should be administered, whether they should be administered federally or whether it should be some sort of a federalist approach, basically, some sort of shared state and federal role. It ended up that Social Security ended up being purely federal, and unemployment insurance ended up being this sort of hybrid. And one can argue, looking at the historical trajectory of those programs, that Social Security has proved far more effective, probably as a result of that exclusive federal administration.
Well, one of the things, sorry,
ahead,
so
Don.
one last point is one of the things they haven't talked about much is the sort of political feedback effects of these programs. And so programs that are big and visible at the federal level, it's easy for people to see them and to understand, I think, political debates about them a little bit more than when they're state-level programs that are driven by state-level politics. And so one of the arguments that political scientists have on this issue is that the more that these programs are dispersed through state and local governments, the less visible they are to people, and the less easy it is to form political coalitions to fix and improve programs.
I think people are looking for some good news these days. Do you have, as this is all unfolded, have you seen any states or cities or localities or programs that have done a better job, that have seemed to have been able to get through some of the overwhelmness and administrative hurdles?
So some states are doing better than others, right? Well, actually, so I think the first point would be there were actually some changes in SNAP, for example, that were great. Like, I mean, they're sort of obvious, but it's still really great that they did them. You know, you don't have to do the in-person interview right now. I don't know how long that exception will go on. But interestingly enough, the sort of in-person interview requirements for a lot of different programs, it looks like it's a huge barrier for people generally. And then obviously in the middle of a pandemic, not a good, not a good requirement. And so they completely relaxed that. And that's, I think, really important and probably has really helped quite a lot. You know, some states, Michigan, worked really fast to roll out that SNAP EBT program, and they did a really nice job rolling it out quickly and ensuring people are getting access to those benefits. So yeah, I think there's been some states have been more effective around unemployment insurance, for example. All states were overwhelmed, but some states had both administrative capacity and maybe hadn't built in so many barriers to begin with that it was easier for them to, you know, say, catch up a bit with their applications. I think Washington State, for example, has increasingly done a pretty good job. So yeah, it is definitely a function of, I think, of which state you're living in.
Going back to the politics of this, I think if there's a silver lining is that more people are aware of the problems in much of our social safety net that they don't normally encounter, and now they're seeing them up close, and perhaps they're realizing, boy, this is not terribly good. And you also see some politicians who, in some cases, have actually introduced many of those problems, now articulating a need for rapid response and ex post rather than ex ante controls. It'll be interesting to see how long those changes in political attitudes sustain themselves after the first round of spending is done, and whether we'll still see them a year or two from now, and whether this really is sort of a Great Depression style moment where we see these formative sets of changes in institutions, or whether we'll revert back to the sort of politics that in many cases created these burdens in the first place.
I would say the other hopeful thing from my perspective is just an awareness of this. So the level of media coverage within the unemployment insurance program and even around some of these issues around SNAP, there's just a level of attention to it that I don't think we saw in the past. And I actually also feel like among academics, there's sort of more of a consensus at this point that that this is like a real problem that we need to tackle going forward. So I think it's become a lot more visible, and I do think a lot more people are taking it seriously in terms of really trying to advocate and make some changes.
You talked about shifting the focus from those few cases of fraud and abuse. Someone wants a cite for that, by the way, but we'll table that for a second, to focusing on those, the higher percentage, 20% of people who are maybe not being served. Do you have any examples of when that strategy, that persuasion strategy, has been effective for particular programs, historically, other countries?
For, in terms of convincing people to focus on the 20%?
Yeah, or change administrative burdens.
So, yeah, actually, I keep coming back to SNAP. SNAP is a great example of that. So in the mid-1990s, kind of in the mixture of welfare reform, there was a huge decline in participation in the SNAP program, like among those eligible. And it was basically because when it was aid to families with dependent children, that was automatically linked to SNAP, and you enrolled in one, you enrolled in the AFTC, and you automatically got SNAP. And so people didn't have to do anything really to get it, or close to very limited burden, basically. When they eliminated AFTC and created temporary aid to needy families, there was no longer that automatic linkage. And you saw this like huge decline in participation in SNAP as a result. And then this was actually during George W. Bush, President George W. Bush, during his 8 years in office. His HHS did actually start working really hard to figure out ways to fix that, to fix and ensure that people who were eligible were getting enrolled in the program. And so they made a whole host of changes to SNAP administrative procedures to increase participation. So I believe at its lowest it was somewhere near 60%. And again, now is somewhere between 80 and 85% in terms of participating as eligible. So certainly, Medicaid, similar thing. Different president, but similar attention to administrative barriers in Medicaid. When they passed Obamacare, the legislation was actually written in such a way that they were going to really push states hard to try to make it easier to enroll in Medicaid in a range of different ways. So yeah, no, there's definitely been periods of forward momentum about reducing these burdens historically.
How much do you, thinking back to the automation and the data systems and the technology from the program administration side of things, how much do you think that contributes to administrative burden? Because in order to make a case that lots of people aren't being served, you need data. And many states may not actually know how many people are not able to get through the phone lines to UI or get the paperwork done.
Yeah, so I think that there's a couple of levels to that question. One is there are other sources of information, so things like using the American Community Survey as alternative sources of information give you a sense of how many eligible non-participants are out there. So we can partly get those answers using non-administrative data, but the administrative data question is really a question of investments in administrative capacity. And so one of the things we've heard about in the last few months is states running COBOL, this very old software system to maintain their administrative records. It's been a long-standing problem with the IRS, which plays a bigger role as any agency at this point in terms of providing social services, that there hasn't been significant investments in their information technology capacity to keep up with their level of responsibility and the number of people being served. And so a lot of the sort of advice we're giving in terms of the use of technology is really the use of technology plus administrative data, which requires some basic investment in these services. And so with the IRS, for example, from about 2012 to 2018, it saw something like a 10% budget cut, even as the number of people it serves dramatically increased, and the range of its responsibilities, including the Affordable Care Act oversight, also increased. And so that there are ways in which the state can shift burdens away from citizens, but they have to have the capacity to manage the ability to do so. And to some degree, it feels like this is an area where our counterparts in places like Scandinavia and Germany seems to have just a better ability to connect individual level data with administrative systems and plug it all together much more easily than we do.
But I don't think it's, I don't think that's why. Like, I don't think a lack of data is why we're not paying attention to this as a key evaluation measure of the program. There's lots of ways to think about how administrative barriers negatively affect participation. And the only thing that they have right now is the Paperwork Reduction Act, which requires you to document how long it takes to fill out forms. And we've seen lots of examples where those estimates are highly erroneous. They're really obviously wrong, and in terms of like arguing it takes substantially less time than it actually does. So even the most basic provisions that they have in place are neither enforced nor are they done very well.
And last question and your last comments. What should we be looking at in the next few months, maybe years, to have learned from the experiences that programs, state, and participants are going through now during this unprecedented pandemic?
So my bellwether will be looking at political attitudes and looking at, as I sort of mentioned earlier, will we see this sustained attention to administrative systems where people seriously take the idea on board of, boy, this did not work well. What do we need to do to fix it and make sure it doesn't happen again? How do we build an administrative state that's capable of dealing with these sorts of crises versus falling back into this polarized discussion where one side says, well, this was just a failure of big government and it demonstrates everything that we've told you about how government is simply unable to serve you. I do think there is the capacity for this to be a very important political moment, but it requires, I think, more public attention and public pressure. And so one of the questions I saw was about, how do we honestly convey this to citizens? I think you have to tell people, honestly, these are the systems we designed, and to fix them, we're going to have to do a certain number of things. Because without that, it's going to be very easy for us to revert back into traditional Republican versus Democratic debates about the social welfare system.
I think the thing, like just briefly, that I always try to remind people in terms of capacity is like we really actually do have the capacity to do it well. And the program, our largest income support program, that's approximately 40% of the federal budget, is Social Security. And we did that extraordinarily well. We're capable of it. And there are actually probably plenty of people getting relief actually through Social Security throughout the course of the pandemic. We're capable of doing this. We've shown we can do this. And that state variation, as much as it can be frustrating to see some states perform poorly, we also see some states perform really, really well. So we are capable. It's just, are we going to choose to make the changes we need to so that everyone benefits from good administrative capacity?
Thank you both so much for spending time with us and sharing your expertise. I want to remind people that they can download the slides, and I want to thank you both for for excellent, excellent insights. And I'll even put in a plug. If you enjoyed this, you'll also enjoy their book. Thank you all.
Thank you, Catherine.